Hey, welcome back to the podcast. I am Debbie Waidl, and today we are diving into something that I think is going to make a lot of women say, "Oh my goodness, that is me," and then finally understand why they felt so stuck. We are talking about POTS, Postural Orthostatic Tachycardia Syndrome. And I know it's a mouthful, but hang in there because if you have migraines, there's a very real chance that POTS is part of your picture, whether you have been diagnosed or not. So here's the statistic that stopped me when I first read it. Multiple studies have found that between 41 and 96% of women with POTS also experience chronic migraines. In one study, 476 POTS patients, 65% had prior migraine diagnosis. Only 8% had no headaches at all. So if you are a woman who has been dealing with both the heart pounding when you stand up, the dizziness, the fatigue, the brain fog, and the migraines on top of all of that, you're not imagining it. And you're not just unlucky. There is a reason these two things keep showing up together in the same body. And here's what I really want to get into today. Most women who have POTS and migraines are being treated for each one separately. They have a cardiologist for the POTS, a neurologist for the migraines, maybe a few other specialists sprinkled in between, and none of them are talking to each other. That is a design failure because POTS and migraines are not two separate problems. They are two expressions of the same underlying issue. And when you finally understand that, everything changes. And that's what we're talking about today. So let me start by making sure that we are on the same page about what POTS actually is, because I think a lot of women have it and have no freaking idea. So POTS is a disorder of the autonomic nervous system. The autonomic nervous system is the part of your nervous system that runs things automatically. Your heart rate, your blood pressure, your digestion, your breathing. You don't have to think about these things. Thank goodness, right? We already have enough to think about. So these things just happen in the background. And in a healthy body, when you stand up, your autonomic nervous system makes a tiny adjustment so that blood stays circulating properly throughout your entire body, including your brain. Takes about a second. You never notice it. And in a body with POTS, that adjustment doesn't happen properly. Your heart rate spikes by at least 30 beats per minute within about 10 minutes of standing. Blood pools in the lower part of your body instead of circulating to your brain, and your nervous system, trying to compensate, goes into overdrive. The system kind of looks like this: dizziness and lightheadedness when you stand up, heart pounding, fatigue, brain fog, nausea, blurred vision, and headaches or migraines. Often severe ones. In the most severe cases, women pass out completely. Some are passing out multiple times a day. Now, here's what I want you to hear. POTS predominantly affects women, and it is dramatically underdiagnosed. On average, it takes about 6 years for a woman to get a POTS diagnosis. 6 years of being told that her heart pounding and her dizziness and her exhaustion is anxiety or stress or just how she is. Does this sound a little bit familiar? Because that's exactly what the migraine journey looks like too. And that's not a coincidence. These two conditions keep showing up together because they share the same root, but we'll get there in a minute. So here's what typically happens when a woman finally does get a POTS diagnosis after those 6 years. The doctor says, hey, you have POTS, and maybe if you're lucky, the doctor will give you a couple things to work on, right? Maybe the doctor will say, drink some more water, add a little more salt to your diet, wear some compression stockings, maybe do some exercise, but do it horizontally to start because, it's too hard doing it standing. But then typically, if it gets worse, they reach right for the medication. And here's the part I really want you to take in. As of right now, there is not a single medication that is FDA approved for POTS. Not one. Every single drug prescribed for POTS is prescribed off-label, meaning it was developed for something else. And doctors are using it for POTS because they have limited options. Most common ones, they're beta blockers, like propranolol to lower the heart rate. Probably been prescribed that for migraines too. Or midodrine to raise blood pressure. And something called fludrocortisone, which is a synthetic steroid that tells your kidneys to hold on to more sodium so that your blood volume increases. Notice what fludrocortisone does. It tries to force the body to retain sodium. But here's what the research also shows. It depletes potassium and magnesium in the process. So now you have a woman who's already mineral depleted being given a drug that depletes her minerals further. And nobody's connecting the dots between those mineral imbalances and why her migraines are getting worse at the same time. Now, to be clear, I am not here to tell you whether to take or not take any medication. That is between you and your doctor. What I am here to do is show you the bigger picture, because medication is doing the same thing for POTS that it does for migraines. It is symptom suppressing. It is not asking why the system is dysregulated in the first place. Okay, now here's where it gets really important. Research published in the journal Headache identified 3 mechanisms that POTS and migraines have in common. And when I read this, I thought, of course, because these are exactly the same mechanisms I see showing up in the inflammation overload loop that drives chronic migraines. Number 1, dysregulation of the sympathetic nervous system. Both POTS and migraine involve an autonomic nervous system that is stuck in overdrive, a nervous system that cannot shift out of fight or flight, that keeps the body in constant low-grade state of alarm. Number 2, hemodynamic instability, blood flow and blood volume issues. In POTS, blood pools when you stand. In migraine, blood vessels dilate and the constriction are part of what triggers the attack. These are not 2 separate blood flow problems. They are the same underlying vascular instability showing up in 2 different ways. And then number 3, central sensitization. Both POTS and migraine involve a nervous system that has become hypersensitive. That overacts to normal stimuli. That has essentially been trained to be on high alert because it has been overwhelmed for so long. 3 shared mechanisms, 1 root, the inflammation network. The system in your body that keeps inflammation chronically elevated, keeps your nervous system stuck on high alert, keeps your threshold so low that ordinary things, standing up, a change in the weather, a glass of wine, are enough to push you over the edge. And when that network is overloaded, it does not express itself in just one way. It expresses itself through every vulnerable system in your body. Now, for some women, that's migraines. For some women, gut dysfunction. For some women, hormonal chaos. And for a very significant number of women, it is POTS. They're not separate fires. They are one fire and they share the same fuel source. Now, I want to get specific about something that I see with women that I work with who have POTS, and it lives right in phase 1 of the Freedom From Migraine Method. One of the 6 areas that we address in phase 1 is what I call electrolyte symmetry. And I want to explain why this is not just a migraine issue. This is a POTS issue. And for women who have both, it is often the first place where things start to shift. Your autonomic nervous system, the one that is dysregulated in POTS, it relies on minerals to function. Sodium, potassium, magnesium, calcium, they are not just electrolytes in your famous sports drink. They are the electrical signaling system of your entire body. They regulate how your cells fire. They regulate your heart rate. They regulate blood vessel tone. They regulate nervous system transmission. And when those minerals are out of balance, and in most women with chronic migraines and POTS, they are significantly out of balance, your autonomic nervous system cannot regulate properly. Your blood volume becomes unstable. Your heart rate becomes erratic. Your blood vessels cannot maintain tone. Your nervous system cannot shift out of fight or flight. And here's where it gets really layered, because most women with POTS and migraines are already mineral depleted before we even look at it. Chronic stress burns through magnesium. Poor sleep depletes it further. And if they are on fludrocortisone, that is depleting potassium and magnesium. If they have gut issues, which they almost always do because gut dysfunction is another expression of the same inflamed network, they're not absorbing minerals properly even when they eat well. Have you ever thought about that? You're like, oh my gosh, I eat my diet perfect. Well, what if you're eating perfectly, but your body is not utilizing that at all? This is a depletion cycle, and nobody is addressing it. They're being told to drink more water and add more salt, which is not wrong, right? We're all going out and buying fancy salt, fancy packets, putting it in our water. But it is one piece of a much bigger picture. So in phase 1 of the Freedom From Migraine method, we use something called the check method to help each woman identify her specific mineral imbalance. Not a generic protocol. Not everyone just go take some magnesium, but look at, your specific picture, because the imbalances look different in different women. Some are depleted in magnesium. Some have a sodium to potassium ratio that is completely off. Some have a calcium picture that is affecting everything. And some need all of it addressed in a specific sequence before anything else can shift. And when we get this right, we actually address mineral foundation. I see women whose POTS symptoms start to calm down alongside the migraines. Not because we treated the POTS, because we addressed the root that was driving both. Now, I wanted to tell you about Kathy. Kathy's from Vermont. When I met her, she was running a busy dairy farm and a market garden business with her husband. And for at least 15 years before she found the Freedom From Migraine method, she was having 25 migraines every single month. That's essentially every single day. But here's what most people don't know about Kathy. She also had POTS, and it was severe. Her husband would find her unconscious on the bathroom floor or on the kitchen floor. She was passing out due to dysautonomia while also trying to manage 25 migraines a month. She tried triptans, over-the-counter medications, monthly migraine injections. Then she had a severe reaction to the injection, and there was no other option left for her because her other health conditions limited what medication she could take safely. She described herself as being at the end of her road. She told us, I was truly at the point of not wanting to continue on the journey of life if the massive head pain I had every day was going to be a part of it. And that is where Kathy was when she came to the Freedom From Migraine method. But here's what happened when we addressed the root cause, including the mineral foundation in phase 1. The migraines started diminishing, not just in frequency, but in pain level, in intensity, in duration. And the POTS symptoms started to shift alongside them because we were addressing the same fire. Her husband noticed early on, days were going by without a migraine. She wasn't passing out anymore. She was present, actually present, not just physically there at family events. She went to her grandkids' birthday parties, actually smiled and laughed instead of sitting there pretending she was okay. She runs her garden business now. She gardens for 10 months out of the year. She gets in the car on a whim and goes to the store. She puts events on her calendar and expects to make them. She says getting a migraine these days is shocking to me. And her husband told her he finally has a big part of his wife back. Kathy didn't get better because we treated her POTS. She got better because we addressed the root that was driving everything. And her POTS responded because it was always part of the same picture. Now, if you want to hear more of Kathy's story, make sure you check out my YouTube channel. The link is in the show notes for you because her story, it's an unbelievable story. I know you're going to want to hear it. Now, I want to talk about what happens when these two conditions are treated separately. I know we hit on this before, but this is so important because I think that this is the experience of so many women listening right now. You go to the cardiologist for POTS, you go to the neurologist for the migraines, you might even have a gynecologist or a gastroenterologist, to cover that hormone and that gut piece, maybe a rheumatologist if there's an autoimmune component. And each one is looking at the pieces, prescribing for the pieces, managing the pieces, symptom suppressing. None of them can see the whole picture because the whole picture doesn't live in any of their offices. It lives in your body, and your body is one system. So when they look at it separately, you go to all these different offices, you end up on multiple medications, each one designed to manage a symptom, to suppress a symptom of the same underlying fire. None of them putting the fire out. And the worst part is that some of them are feeding the fire. Think about that. Some of the medications that you're taking to try to feel better from POTS, feel better from migraines, they're actually, in the long run, fueling them. Because some POTS medications deplete the very minerals that your nervous system and your migraine threshold depend on. And nobody's connecting those dots. Think about what Kathy's life would have looked like if her POTS cardiologist and her migraine neurologist had kept treating her in separate boxes. She would have kept getting prescriptions that depleted the very minerals her autonomic nervous system needed to regulate. Fortunately, we caught that. We saw that. And then she could have a conversation with her doctors and make sure that she did what was right for her. When we met, she was already out of options, allergic to the last medication available to her, no path forward. The conventional system could not see what was happening because it was looking at the parts. It was treating the POTS as a heart problem and the migraines as a head problem, when they were both expressions of one dysregulated, overloaded nervous system. And listen, I'm not trying to say the specialists are wrong. I'm saying they're operating within a system that was designed to treat parts, not the whole. And for women whose bodies are expressing one problem through multiple systems, which is exactly what the inflammation overload loop does, that approach is always going to leave them stuck. The path forward, it's not a better specialist. It's not a new neurologist. It's not going to some new pain clinic or new, heart clinic. It's a whole body framework that addresses what is actually driving the dysregulation. Now, another Freedom From Migraine Method member, Barbie, said, I know for sure that getting the right amount of salt for my body made a huge difference in my POTS. My doctors had mentioned salt before, but looking back, it was never really enough to move the needle. And since going through the Freedom From Migraine Method, I now understand how to properly balance my main electrolytes, including salt, and it has completely changed things for me. My POTS symptoms are now very mild compared to what they used to be, and honestly, I rarely even think about it anymore. So now that you've heard Kathy and Barbie's story, let me give you a few things to take away from this episode. Number one, if you have migraines and these symptoms, pay attention. Heart rate increasing when you stand up, dizziness or lightheadedness when you rise from a chair or a bed, fatigue that does not match your energy level, brain fog, nausea. These are worth discussing with your doctor, even if you only have a few of these. POTS is underdiagnosed. If you have been dismissed before, ask specifically about a tilt table test or reach out and ask us about an HTMA, hair trace mineral analysis test. Number two, your minerals matter more than you know. The autonomic nervous system that is dysregulated in POTS runs on minerals: sodium, potassium, magnesium, calcium. If you are mineral depleted, and most women with chronic migraines are, your autonomic nervous system cannot regulate. Start paying attention to this piece. Not just drinking more water, not just adding salt to your food, not just adding salt to your water, but actually looking at your mineral balance as a system. Number three, do not let the diagnosis separate the conversation. POTS and migraines are not two different problems that need two different doctors with two different treatments. They are two expressions of the same thing. When you address the root, the inflamed, dysregulated nervous system, and the inflammation network underneath both conditions respond. This is not a coincidence. That's biology. And number four, the sequence matters. This is why we start with phase one in the Freedom From Migraine Method. Before we address hormones, before we address genetics, before we address the deeper the drivers, we stabilize the foundation. We get the electrolytes right. We get the nervous system out of constant high alert. We give the body a fighting chance. And what I see consistently is that when we do this, the POTS symptoms start to calm down alongside the migraines because they're fed by the same source. So if you've been listening to me and you've been thinking, this is me, I have both. I've been treated separately for both. Nothing has fully worked. I want you to know that this is one of the most common pictures I see. And it's also one of the most transformable. Because when you stop managing the symptoms and start addressing the root, the body knows how to respond. I have watched women who were barely functioning, dizzy every time they stood up, migraines 3 weeks out of 4, get to a place where the POTS symptoms, they're barely a memory. And not because we targeted the POTS, because we addressed what was fueling it. So if you want to understand what your specific picture looks like, what is actually driving your inflammation network, where the mineral imbalance live, what the path forward looks like for your body, I want you to book a complimentary migraine breakthrough assessment with my team. This is a 45-minute conversation. We look at your full history. We map out what is actually happening, and you leave with more clarity about what is driving your migraines and your POTS symptoms than you have probably gotten from any specialist appointment. The link's in the show notes. Go book your spot. And if this episode resonated with you, please share it. There's so many women walking around with a POTS diagnosis and a migraine diagnosis, and no one has ever told them that they're looking at the same fire. Send this to someone who needs to hear it. All right, we'll see you next week.